Welcome to FAQ, where your patient questions are answered by leading experts in medicine and wellness. And now, here's your host, Hailey Hough.
And welcome to FAQ. Today our question comes from Alan, a college student in Allentown, Pennsylvania. Alan asks, from a historical standpoint, does the college have a right to mandate vaccines of all students? And how about mandating proof of vaccine for faculty and staff? To answer your question, Alex, we turn to our guest expert, Gerri Taylor. Gerri Taylor is the co-chair of the COVID-19 task force of the American College Health Association. Taylor co-leads a multidisciplinary team tasked with advertising to colleges on everything from reopening and creating safe campuses to protecting high-risk students to advocating for vaccinating COVID-facing health center staff against the pandemic. As a spokesperson for all things COVID and college health, she has been quoted in dozens of national news outlets, appearing on the Today Show, Inside Higher Ed, and the New York Times. She assumed this important position with the ACHA after retiring from her role as Associate Dean of Health, Counseling, and Wellness at Bentley University in Massachusetts, where she directed a collaborative health model that integrated mental and physical health, as well as health promotion, a model she feels she best addresses the changes that have been occurred to college health over the past 30 years. So could you first tell us about ACHA and then shed some light on the historical background on this current issue?
Thanks so much, Hailey. It's really nice being with you today, and thanks for that introduction. First, just to tell you a little bit about ACHA, it stands for the American College Health Association. Its mission is to advance the health of college students and campus communities. Health and well-being of our college students is our primary concern. Our membership includes about 700 institutional members. That includes public, private schools, small, large, faith-based institutions, HBCUs, historically Black colleges and universities, and their schools from all over the country. We also have about 7,500 individual healthcare professionals, including doctors, nurses, nurse practitioners, PAs, health educators, and counselors and psychologists. It's a really robust organization. Now, to answer Alan's question, I'll start with the historical background. Vaccine requirements for schools are really not new. They've been around for a long, long time. The earliest recorded vaccine requirements were in 1850. And then in 1900, there was an outbreak of smallpox in Massachusetts, and vaccine requirements again kind of were instituted. Since then, over time, there's been more and more requirements based on epidemics that were going on. We had polio in the 50s and measles in the 60s. And what they found was that these vaccine requirements actually held the numbers of cases of illness down and really made our campuses safer. So it's not unusual that they've instituted this now with colleges in relation to COVID, which is such a serious novel illness. It's affecting older people, but even more so now, the Delta variant is affecting younger people, and we're concerned about our college students because of that. So you might wonder, how are vaccine requirements put into place? The CDC makes recommendations. So they have recommendations for schools, for daycare centers, and even for colleges and universities. And they make the recommendation, but then each state has the personal ability to either accept those recommendations or not. It's a states' rights issue. And some states are very strict and some are not so strict. But many of the colleges now have accepted the idea of a requirement for COVID-19 vaccine And right at this point, the Chronicle of Higher Education reports that about a little over 1,000 colleges are requiring it at this point in time. Some of the other vaccines that are required for colleges are measles, mumps, and rubella, tetanus, diphtheria, pertussis, meningitis, and these incidents of those campuses safer. So, you might wonder, why did ACHA institute this? I think initially we were hopeful that people would just get the vaccine, but that didn't appear to be happening. So we made the statement in April saying that where state law, and I'm reading this now, where state law and available resources allow for all on-campus college and university students for fall semester 2021, in accordance with the Institution of Higher Ed's normal exemption practices, including exemptions for medical contraindications, that they would recommend the colleges require the vaccine. We feel that the vaccine, along with the mitigation strategies of masks and distancing and contact tracing, testing, all of that full package, that's the best way to make our colleges safe for students. So, we often think of colleges as places where there are all healthy students. That's not really the case anymore. Years ago, students who were, who had chronic illnesses and were really suffering with either cancer diagnoses, cancer treatment, diabetes, all kinds of diseases, they could not go to college, but now they do. So we need to worry about their risk factors as well, and the faculty and staff, and the fact that students now are not all traditional age of 18 to 22. We're seeing more and more older students, certainly the military who comes back, who are going into college. So it's something we have to consider everybody on campus, not just the healthy college students, because there are many others there. So I'll stop there, and if you have any other questions, I'm certainly happy to answer them.
Yeah, well, definitely. That makes complete sense, and I think that does answer his question. I was just curious. So, knowing the controversy that kind of was behind the whole vaccine and, COVID in itself, it was very divided in the opinions. Did you kind of anticipate this response, or were you prepared to deal with, these kind of upsets from students and faculty? And did you guys see this coming, I guess, is my question.
We're frankly not seeing that much controversy. There certainly is controversy out there. However, I've been aware of some students who chose to go to different schools based on the fact that if the school they were going to didn't have the vaccine requirement, because their families wanted them in a safe environment. So I've kind of seen the opposite, although there are both sides out there for sure. And we definitely expected that there, we wouldn't have 100% agreement with this recommendation. However, it's our firm belief that this is the only way to make areas safe. In fact, just this past week, there was an article about a college in Colorado that only had, I think it had almost 10,000 students, and they only had 126 cases. And they feel it was because they had the vaccine requirement. We're also feeling, and I'm certainly biased, I really believe the college health centers are doing a fantastic job, but that they have kept the cases down on college campuses through the vaccine. I don't think there's any other segment of the population that have instituted the contact tracing, the testing, all of those strategies that the colleges have. So, you know, I kind of give a shout out to the colleges for doing that.
Yeah, definitely. So I think, and you know, my final question, I guess, and you know, answer how you'd like. You do not have to, anyways. But you know, playing devil's advocate here, this is just, and I agree with you 100% on your standpoint, and I am with you 100%. And so, me myself, I have tried to explore the other perspective and why, you know, this is such a hard pill for them to swallow. You know, um, and so I asked around or did some research, and one big thing that I did find was, you know, people are upset that it's being mandated only in some cases. For instance, like on college campus or on, you know, in class environments or really inside any buildings, you know, we're required to wear masks and fully vaccinated and everything. And then I guess the controversy comes because the football events or stuff like that, it's not, I mean, that same kind of mandate isn't really pushed. And I don't know if that is related to, if that may be starting, you know, the MSU student policy, because it's all kinds of people come to the games and things like that. And maybe that's why they didn't mandate it, because this is a event that isn't just their students, so they can't control that much or whatever it is. I was just wondering your opinion on that and where you would, you know, identify that, how you would identify.
Sure. Such a good question, and certainly something that we've looked at as well. It's kind of fascinating that we are not seeing major outbreaks from those outdoor events. And I really believe it is because they're outdoors. I am concerned about what is going to happen in the winter when we move indoors, and certainly hope that there will be more serious strategies in place to prevent that. Because when you're outdoors, the virus is not transmitting as well. It's being diluted by by so much air around. And you know, there's good research that shows that if you're indoors, you know, you need to have windows open, exhaust fans, HEPA filters, which many of the colleges now have in their exam rooms and in their waiting rooms, and some of the colleges even have them in their classrooms. There are also these monitors for carbon dioxide. They're little square devices that you can carry in your backpack or in your purse or your pocket even, and it measures the carbon dioxide, and that can give you an indication of how dense the air is in a space that you're in. I understand that some places in Europe actually have these devices in bars and restaurants where it gives the number. And if the number is above around 800, then they clear the place out and they actually air it out and then let people back in. So, you know, those are strategies that we can think about for once we go indoors in the winter. But it's a really good question. And I think it's quite fascinating that we're not seeing the outbreaks at these games when there are 100,000 people packed stands.
Right.
But I do believe it's because of the outdoor air. Put those people inside, and I think you have another situation. It's a little more risky.
Right.
You asked, I just want to get to the one other question that Alan asked about faculty and staff.
Yes.
And that's not in our domain. That would go through human resources. However, that said, we worry about the faculty and staff because more of them are older, more of them may be in risk categories. And so, and we don't want them spreading it to the students either.
Right.
So our concerns are the students, the faculty, the staff, and the local community, because if students are going out to bars or restaurants or shops, you know, if they're not wearing masks, you have to be concerned, community
Yeah,
responsibility for
definitely.
public health.
That's very interesting. I did not know that that was outside of your guys'
Yeah.
domain at all, because I actually, I'm a current student at MSU, and like right before my classes started, actually, we got emails. I got maybe 2 out of the 5 classes that I was enrolled in, but just the professors informing us that they will be taking a semester off, and because they don't, feel comfortable in the space yet, or I'm not quite sure. I don't know if they were required any sort of vaccination or anything. Obviously, that goes through HR, as you said. So that's definitely interesting, because I did wonder about that. If we're all being required vaccines, why are they still not feeling safe or whatever? But I understand definitely for those compromised.
I think they're
definitely might.
compromised, and the faculty, staff, and students who might have people that they're living with, whether they're
Right.
kids who are unvaccinated or high-risk individuals, those concerns come up. So I would love to see everybody vaccinated
Right.
on campus, because that will make it safe for everyone. However, that the faculty and staff are not in our domain.
Well, awesome. I think you answered perfectly, and I really appreciate you coming out and talking to us today. I think you answered a lot of people's questions today, not not only Alan. So this is definitely so useful, and clears a lot of things up for, especially, some frustrated college students or people being left in the dark. So I really appreciate you talking with me today.
So much for having me, and I'd be glad to talk to you anytime.
Well, thank you so much.